Do wheat-based foods always tend to give you trouble? Hi, I'm Luke from Active Health Clinic, and if you find that things like breads and pasta and noodles, they always seem to give you an upset stomach, maybe some bloating, some nausea, maybe they change your bowel movements, well, you might be thinking that wheat or maybe even particularly gluten might be causing you some challenges. But when we're reacting to wheat-based foods, there's a few things that can actually be going on. It can be the wheat grain itself. It can be gluten, in which case we need to check for celiac disease, or it could be fructans, which are a fermentable carbohydrate in gluten that actually cause your gut bacteria to produce lots of gas and change the way that water flows in and out of your bowel. They can cause some pretty impactful symptoms. So there's often more going on than it simply just being gluten, even though that's what we hear everywhere, that gluten's the issue and we need to cut it out. So I'm here to tell you, please, before you go ahead and cut gluten out of your diet, make sure you go and get tested. Get a blood test, check if you even have the gene, or go and get a gastroscopy if that's what your gastroenterologist requires you to do, so that you can get a biopsy and check it out properly. If you stop eating wheat-based foods before you do that testing, you will have to do it for life. We won't know whether you have celiac disease or not, and the only known treatment at the moment for celiac disease is just to take all gluten out of your diet. We don't want you to have to do that unless you really need to. So please, go and get tested before you take wheat out of your diet. Another quick tip, try some spelt bread or some sourdough bread and see if either of those have less symptoms in a similar quantity of food to your normal wheat gluten-based foods. If they do, then you might be looking at something else rather than gluten. If you've enjoyed this tip, check out our socials and our YouTube for more. And as always, happy eating.